Welcome back, everyone, to the first episode of the, I shouldn't say welcome back, but to the Maryland Oral Health Association's podcast, The Voice of Oral Health. Today we have on a special guest, Dr. Howard Haft from the Maryland Department of Health, I think is a senior advisor there. So welcome, Dr. Haft.
Oh, Jonathan, thank you very much. It's a pleasure to join you today in this important conversation.
Very good. Well, we're glad that you could join us today. And for our listeners, there's a few things that we really wanted to talk about here in this first episode. And, we're just getting out of the COVID space. We're becoming a little bit more normal in our daily routines. But could you kind of clarify some of the state's responses around COVID and, the focus on some of the COVID therapeutics?
Yeah, Jonathan, I think that's a really great question. And I think you're exactly right that we are transitioning now from a time of great fear and concern to a time when we're really learning how to manage this virus. And therapeutics are a big part of that management. Of course, it starts with vaccines. We know for certain that vaccines are the first line of defense in building that immunity against the virus. And it includes vaccines and the necessary boosters that we need to have. It also includes people being personally responsible for their health. And that includes for those fragile or vulnerable individuals when there is obviously transmission within your community, to taking the proper precautions. These are not mandates now, they're just common sense things like staying out of crowds if you know you're susceptible and vulnerable, wearing a mask when it's appropriate, and those kinds of things. But now we also have really potent therapeutic agents so that when people do contract this virus, and many people still do, that we have treatments for them, something that we didn't have at the beginning of the pandemic. And that's part of being a big game changer here. So we can really manage this disease much better. In fact, we can manage it now where we couldn't manage it before. You remember at the beginning of the pandemic, when people got COVID, could be a death sentence for many people, particularly the older people, particularly those in skilled nursing facilities. That's not the situation anymore. Now we have potent therapeutics, just like we have for flu and other kinds of viral infections.
Very good. Thank you for that overview of some of the therapeutics. Therapeutics kind of came later in the pandemic. And, one of the first things that we had to really ramp up as a state was testing for COVID-19. So can you talk a little bit about how the state prepared and kind of ramped up testing during the peak of the pandemic?
I'm certainly happy to tell you about that. And it's a great story. That early on, again, in the pandemic, tests per se were few and far between. And they took sometimes days and days to come back. But because of technology and because of the ability of our nation and others to be able to mass produce technology after it's been refined, and with the ability of the FDA to rapidly process those tests and assure that they were safe, that they were accurate. We've gone from a scarcity of tests to a real abundance of tests, and the state has gone really overboard in terms of the ability to purchase those tests, to distribute them. The federal government has done that. We've distributed tests to all of our primary care providers so that they can do testing in their offices. The state has established, when they needed to, tents all around the state, outside of hospitals and outside of emergency departments, to allow people to get rapid tests and PCR tests. So tests are really very important. It's important for two reasons. One, for people personally to understand when they have symptoms, is it COVID? And if it's COVID, to take the proper actions. And the first action is to contact your provider, or if you don't have a provider, one of our state services, to see if you're eligible for therapeutics, whether oral antivirals or monoclonal infusions or whatever appropriate therapeutics. It's also important for people to be able to test right away when they have any symptoms, to know what they should personally do. So if I test positive, it means I don't want to go out and infect other people. I want to stay home and isolate, and want to tell people who I've been in contact with that they should get tested also. So tests are another part of that, what I call kind of the triple play. in managing COVID. So it's a baseball kind of term, a triple play. It's really important to get those triple plays. You can really end an inning or end a game, and that's what we're doing now with COVID. And the triple plays are testing, vaccines, and therapeutics. Those three things together. Vaccines in front, and testing and therapeutics right after that. So really important things.
Yeah, very good. Thank you for your again overview of the vaccine rollout into the state of Maryland and the importance of getting your vaccines to help. Are there any current initiatives that the Maryland Department of Health or Maryland is doing currently to continue to address some of the still lasting effects of COVID?
Yeah, absolutely. Let me just tell you about a couple of those. But first, I want to point out a really important fact, in that vaccines do not prevent you from getting COVID. They prevent you from getting severe COVID, hospitalization, and death. The same thing with the therapeutics. They don't prevent you. They're used once you have COVID, and they prevent you from getting the bad outcomes, the severe COVID, hospitalization, or death. And that's really how we manage most viral infections. It's really hard to prevent them, but if you can manage it so that it's not a serious condition, it's a mild condition or a moderate condition, it's a much different scenario than having to worry about large numbers of people being hospitalized or dying. But now to something new that's on the horizon, and in fact, it's not even on the horizon, it's implemented now, and that's the wide availability of therapeutic agents. And I speak specifically to the oral antiviral agents, like one that's called Paxlovid. Paxlovid is a pill that you take for 5 days that had, compared to placebos, had 88% reduction in the need for patients to go on to be hospitalized or die. Those are an enormous amount of improvement compared to placebo. So really potent, really well tolerated, requires a prescription by a provider, a physician, a nurse practitioner, or a PA, because there are some drug-drug interactions and it needs to be dose adjustments depending on people's underlying medical conditions like kidney problems and those things. But they are widely available across the state in 700 different places across the state, including 80 or 90 facilities that we call test to treat places, where patients, if they don't have a physician that they can call up and say, hey, I tested positive, can you prescribe this for me? Or don't have a physician that they can go to their office and be tested and have the prescription. These test to treat sites are beginning to end. Patients can go in there, they can get tested, they can get evaluated by a provider, and they can get a prescription right there. Some of those are urgent care sites. Some of those are CVS pharmacy, those that have the minute clinics, and some of them are other kinds of sites. So all of those sites are listed on our state website, on the MDH website, the GOVAX website. So patients, if they want to find out where they can find one of those, can go to that website any day. It's updated on a very frequent basis, and find out where they can get treatment.
So that GOVAX website you're talking about, so individuals that are still wanting to get a booster or wanting to get that first initial dose of the vaccine, can they also go there to find out where in their community the vaccine is available?
Absolutely. It's a wealth of information. Tells you about who is eligible, what the time frame is for boosters, things like very recently in the last few days. I don't know when this podcast will be broadcast, but as of the time we're recording it, in the last 2 days, boosters became available for those children 5 to 11 years old. So that was immediately available on the website, for instance. Wealth of information and lots of resources there for everything related to COVID, including the therapeutics, the vaccines, and testing sites.
Very good. You mentioned that the vaccine doesn't prevent COVID-19, which is very important for listeners to understand that. But looking at prevention and just kind of community transmission and going as we're weaning out of the pandemic, are there any prevention tips? Is it I mean, we have the general ones like washing hands, coughing into your elbow when you sneeze or cough, but anything that you can point to that would prevent community transmission specifically to COVID that we should be focusing on?
Yeah, thank you. That's a great question again. And transmission occurs from person to person. So it is really both the responsibility of vulnerable individuals and the responsibility of people who have symptoms to be able to manage their own environments. That's really the main tip. So for people who are vulnerable, people who are older, people who have underlying medical conditions, who would likely go on to have more severe COVID, those who haven't had their boosters or not up to date for vaccines, they should be cautious and go about going out into crowds in general. They should wear masks, particularly when they're indoors. And that helps protect them, but it also helps it helps keep transmission limited, because the fewer people that get this, the fewer people there are to transmit it. But the other big tip for how do we control transmission is test, test, test. The more you test, the more you know whether you have COVID or not. And if you have it, staying where you are, not coming in contact with other people until you're free of the ability to transmit it, is how we manage any viral illness or any epidemic or pandemic. It's about isolation and quarantine. But you don't know who should isolate or quarantine unless you test. There's again a difference from the beginning of the pandemic. In the beginning of the pandemic, we said, let's lock everybody down. We don't need to do that now anymore because we have plenty of tests, and we can only ask those people who have come in contact with someone who has COVID or people who have symptoms themselves to test and find out whether they should self-isolate or quarantine. So that's really the way we control this, is keep people who are carrying the virus away from others who could catch it.
And I saw just recently that the CDC and the federal government have now allowed another household to order more tests. So just in the past few days, you can go in again and order some more of those rapid tests. You could self-test at home. So there's a variety of other options out there, places to go get tested or at-home tests that are very important. Are there any guidelines, recommendations, like if you were to have COVID, that individuals should be staying isolated for a certain amount of time that you can talk on?
Yeah, I can, but I would refer you to the CDC website for that. But fundamentally, there's a difference whether for isolation and quarantine, whether or not somebody is fully vaccinated and boosted. So those people who are fully vaccinated and boosted tend to shed virus for a shorter period of time, and they might be able to, at the end of 5 days, be able to go back out into the community, avoiding vulnerable individuals and wearing a mask until the 10 days are up for the total isolation period. People who are not fully vaccinated and boosted should probably stay in for that full 10-day period. Of course, people who remain symptomatic should retest, but that's the general guidelines. There's some nuances to that, but I would again refer individuals to the CDC website, which has a really clear chart that will, if you forget what I've said on this podcast, that you can refer back to that chart and be refreshed in your information any day.
Very good. As we wrap up this enlightful and exciting conversation around COVID-19 and the Maryland Department of Health, is there anything that's very in particular around COVID and the state's response that our listeners should really know about?
Yes, I think Maryland has demonstrated such an incredibly good response, such great leadership from the governor on down to every aspect of every part of the state, local health departments, the counties, the communities, the way the public has responded. So we are one of the most highly immunized states. We are one of the states that have used more innovative techniques and methods, invested more of our time and talent, and used our excellent advisors at our universities to help guide our health departments to guide our responses, and it shows in the results. And I think that's something that Marylanders should be proud of. We've come a long way. But the last thing I want to leave people with a message is that we've come a long way, but there's still a way to go. And we should take our own personal responsibility to make sure that that we get fully immunized, that we test when necessary, and when symptomatic and testing positive, that we rapidly seek the appropriate therapies. And then we're able to manage our way through this pandemic and get out the other side and back to a completely normal situation.
Yeah, thank you for leaving our listeners with that final closing remarks. To kind of sum this up here, Dr. Haft has talked about vaccine testing, treatment, and these test to treat locations. And as we're talking, I've did some research, and covidlink.maryland.gov/content takes you to the Welcome to COVID's Link website that the Maryland Department of Health has. There are 4 things when that website pops up: a tab for vaccines, a tab for testing, a tab for treatment, and a tab for test and treat locations. And you always can call the 1-855-MD-GOVAX for more information about your appointment locations, locations in general, to get your vaccine, including those boosters. Operators are available to assist you if you have any questions. So thank you again, Dr. Haft, for being on our podcast and giving our listeners here in Maryland a very good overview of the state's COVID response, some of the therapeutics that are out there and available, and just good overall general health tips for as the state is continuing to progress and get back to a little bit of normalcy.
Jonathan, it's been my pleasure. Thank you.
Appreciate it.